So when I tell a patient that they're going to have to catheterize themselves to get urine out of their bladder, they look at me like I am nuts. They look at me like this. But let's talk about it. Let's talk about why you can do it, why we recommend that you do it sometimes, and let's talk about all the details of it. Stay tuned. Hey guys, Dr. Segal here. So the question is, my doctor wants me to catheterize myself. Are they nuts? They might be nuts, but let's talk about why they might have told you to do this. And at the end, I'll tell you my pearl of wisdom, probably the most common misconception about intermittent catheterization that exists. So make sure you stay tuned till the end to learn about that. So why do we tell people to catheterize, right? So if urine is not getting out of the bladder, this is problematic for a variety of reasons. Number one, you're going to get urinary tract infections. Number two, stones can form in the bladder. Number three, and I use this analogy all the time, we're like plumbers, right? So if urine is not getting out of this bladder, it's going to back up to the upper urinary tract, so the kidney, so it can cause kidney damage. So there's a number of different reasons why we need to get urine out of the bladder. Now let's talk about the clinical reasons why we recommend intermittent catheterization sometimes. So if you have, let's draw a prostate in here, okay? So we're gonna draw a prostate just like that. If you have a really big prostate and your urologist says your bladder doesn't work, and you can see other videos to describe when that happens, then sometimes they may ask you to put a catheter in your bladder a few times a day to get urine out. Now, that's a situation where your prostate is very large, your bladder doesn't squeeze, and if it doesn't squeeze, urine can't get out, and we got to get it out one way or another. So that's one reason why. Sometimes we'll do surgery on someone to open up what's called a urethral stricture. A stricture is a narrow area of the urethra. It's like a pipe that has a small opening, and then we have to stretch that area up. Once we do that, we want that to stay open because obviously we want the urine to get out from the bladder. So if you have a stricture down here, okay, and you put a catheter in through that stricture once a day, sometimes every other day, it's going to keep that area open and more durably allow for that dilation that you had of that stricture to work. Okay, so people that have had urethral strictures and have had a stretching procedure, sometimes will have them catheterize themselves to make sure that area stays nice and open. Some people have what's called a neurogenic bladder, and that means that their bladder just doesn't function anymore. I've seen patients with really bad diabetes. The nerves that go to the bladder aren't functioning properly, and their bladder just doesn't empty. It just doesn't work anymore. Individuals like that, we may recommend that they catheterize themselves to get urine out of the bladder. Sometimes we'll tell people to do this temporarily until surgery. Let's say you talk to your urologist, the urologist says, you know what, Jim, I think we need to open up your prostate to get you peeing better. You're not peeing. And you say, great, but I'm not peeing right now. How am I going to get urine out? There's a couple different options. One, we can leave a catheter in the bladder, which is problematic because it's a huge infection risk. Or two, we can have you catheterize yourself. And so oftentimes we'll teach people to do that before a prostate surgery. Some people will have retention for other reasons. So the most common reason I see this after other surgeries is orthopedic surgery. So if an individual has an orthopedic surgery or another major operation, the combination of being immobile, meaning not moving around, the combination of anesthesia, constipation, general debilitation, meaning you're not that strong, makes it so your bladder doesn't function temporarily. Now, when those things get better, when you get further out from anesthesia, when your constipation gets better, when your pain gets better, you're not using narcotics, then your bladder will regain function. So oftentimes we'll teach those individuals how to catheterize themselves until, for lack of a better term, their bladder kind of wakes up. And when their bladder wakes up, they're peeing normally again. So it's a bridge until their bladder gets to a point where it's squeezing like it used to. There's another situation where I think it's very, very helpful. There are some patients with an enlarged prostate that are predisposed to urinary retention for a variety of reasons. If they take cold medication, if they drink alcohol, if they fill up their bladder too quick, and they'll have recurrent retention. But for whatever reason, they don't want to get surgery or they're not a candidate for surgery to open up their prostate. Sometimes we'll teach them intermittent catheterization as a rescue technique. What I mean to say when I say this is that they're not catheterizing themselves all the time, but we'll give them catheters, do a teaching session so that if they're ever in a bind, they're in one of the situations that I just said. So they took cold medication, their bladder's not functioning properly, the prostate's obstructing them, and it's 3 o'clock in the morning. Well, guess what? They can catheterize themselves and avoid a trip to the emergency room. So that's another circumstance where individuals may learn to catheterize themselves as a rescue technique, is the way I like to describe that. When people think about it, I usually use this terminology. It's very daunting, but it's liberating. So it's scary to have to do something. I mean, I've never catheterized myself, and even when I think about it, I think about how would I do something like that? But it's very liberating. So for all the reasons that I just said, it is a very scary thing when somebody can't empty their bladder. For all of you that are watching and have been through that, you know what I'm talking about. If you have a way to empty your bladder, it can be very liberating for you. So once you get through kind of the acute period and the teaching period, a lot of people really, really like it, believe it or not, when I say that. Now, one of the tips that, and this is the other thing I want to go through, is some tips to make you more successful at catheterizing yourself. Easier said than done. I know it, okay, because I've taught lots and lots of people to catheterize themselves. The more that you can relax, the easier it is to do it. And that's so many things in medicine, so many things in surgery, so many things in life, really. But there's a physiologic reason for that. Your urinary sphincter, let's say it sits right here. When you pee, okay, you have to relax, okay? Your parasympathetic system, which is the system that kind of gets you to relax in your body, has to go into a little bit overdrive, just a minor overdrive, okay? And then that sphincter relaxes and you let urine out. If you are all tensed up and you're trying to put a catheter in backwards into your bladder, that sphincter is super tight and you can't get the catheter in. And more than that, it hurts, because the number one place where people will get stuck when they catheterize is right at that urinary sphincter. If that sphincter is closed up and tight, it's going to be hard to get that catheter through there, and it hurts when you try to push it through there. If you can mentally get to a place where you can relax that sphincter and just relax in general, that catheter will float in and you're going to do really, really well with it. Now, you know, we have nurse practitioners and physician assistants that do a great job teaching kind of mental techniques on how to relax the urinary sphincter. And I'm pretty sure your urologist would have a similar resource. So, you know, ask them for that for sure. Use plenty of lube, okay? That's another big tip. So some guys and girls aren't using a significant amount of lubrication, and that can make catheterization very, very difficult, as you can imagine. People ask whether it should be clean intermittent catheterization or should it be sterile intermittent catheterization. Clean means that you actually reuse the catheter, and after a certain amount of times you get rid of it and then use a new one. And the most common reason why people would do this in the past is you get more bang for your buck, right? The catheter that's reusable is cheaper. This day and age, sterile catheters tend to be a whole lot cheaper than they used to be, okay? So if we can, we try to get our patients to use sterile intermittent catheterization, which is a single-use catheter. Oftentimes these things are foldable, so they're just this long, okay? They'll fit in your pocket. They're self-lubricating, so you don't have to bring a separate packet of lube. They will lubricate themselves when you open it up, and then you just get rid of it. So people will disappear in the bathroom stall. Nobody will know. They'll do it, and that's the end of it. So sterile's better than clean in general. And this is my kind of pearl of wisdom that I want to impart upon you all when you watch the end of this video. People think that intermittent catheterization is a higher infection risk than having what we call an indwelling, or a catheter that's staying in the bladder. That is not true. People think because you are taking the catheter out and putting it in multiple times a day, it is causing more bacteria to go into the bladder than if you were to just leave a catheter in all the time. Absolutely not true. Intermittent catheterization is a far less infection risk than a chronic catheter. And it has to do, you know, if we talk about this as the urinary sphincter, I think we mentioned this in some other videos. A catheter that goes in the bladder is bypassing the sphincter continuously. So bacteria is constantly going into the bladder. When it's constantly going into the bladder, you're always going to have a positive urine culture if you check a urine culture on somebody with a chronic catheter. When you intermittently catheterize, for sure, you are introducing the potential for bacteria into the urinary tract, but especially if you're using a sterile technique, that inoculum or that amount of bacteria that's going into the bladder is way, way, way less than having a chronic indwelling catheter. So I want you to know that. That is kind of catheterization on your own 101. I hope that's helpful to you all. I hope that it's somewhat empowering. You can do it. I'm confident you can do it. Thank you so much for listening. We certainly appreciate it. Please subscribe to our channel. We do put out 2 new videos each week. Thank you again, guys.